is everyone being for Halloween?
Ooh.
Ooh. So Sarah and I are here. I am Mandy. If you are new to the channel, I'm the birth nurse, and Sarah Walborn and Sarah's a childbirth educator and doula, and we teach together Fearless Birth Delivered. And today I want to challenge you about your prenatal care. So, are you getting the most modern, the most up-to-date prenatal care right now from your provider? Yes or no? If you were, why are you here? Oh, I don't want you to leave. I don't want you to like feel bad. I'm glad you're here. But if you were, why are you here, right? So, why are you watching this video? Why are you here with us? What I want to ask you first is, what is parent-centered care to you? Let us know. We'd love to know where you're watching from. Also, let us know that if you're watching live, type that up. So things are changing. Things are changing in the way that people want and view their pregnancies and their births. They want participation. They want more control. They want answers. If I'm wrong, tell me. Challenge that. I'd love to hear that. That's what I'm saying. That's what I wanted. That's the conversation. That's word on the street, right? Medicine, however, is taking a while to catch up. It's taking a while to catch up in that change. And I would actually argue that medicine has never really been in the forefront of low risk birth and pregnancy support, right? I'm like full of controversial
I know. We're
statements
just like,
today after that stirrup story and reel that I did last night. I'm like dropping bombs. So how do you know if your provider is keeping up with the pace of this change? How do you know? Because we don't take videos into our prenatal appointment and we only have one-sided conversations about what the appointments are like. We don't know what other people are experiencing. Also, Sarah and I have the privilege and ability to talk to other people around the world about what their appointments are like and what their pregnancy support is like. So let's share about that. So tell us what your appointments are like, what your experience has been like so far, or what you hope it would be like. And I want to tell you what I think is old school. So, old school way of managing and supporting pregnancy and birth is not that far away from what you have seen before. It's parallel with how sickness and illness are managed right now, right?
yes, yes.
Yeah, it's medical model. So, the medical model was developed to take care of sick people, dying people, take care of illness and disease inside of hospitals, inside of clinics, inside of people's homes at the beginning. And what did that model? So that all happened before birth was inside of hospitals. Birth was in homes and birth centers, surrounded by family and doulas and midwives. Not do I mean doulas were like your family.
Yeah,
Yeah.
exactly.
Right? Even extended family are like neighbors, aunties, um, people who
Yeah,
had given birth or seen birth a lot. Those
right.
are people, right? They were the doulas of the time. So if we're managing pregnancy and birth the way that we've been managing illness and sickness, is that wrong? Well, this is what it sounds like. It sounds like a reactive approach.
Yes.
It's putting
I love that term though, because it makes so much sense whenever we talk about reactive versus proactive and
I
like,
do too, and I was so excited that I remembered it because I don't remember that term very often. I was like, "Oh, reactive is like waiting until something happens." So, isn't that how it feels when you go to an appointment? When you go to 20 appointments while you're pregnant? About, like, how many is it? Like 15?
oh my gosh.
I felt like I spent a full
Yeah.
work week at the office, like, waiting, and then you get your
Yeah.
blood pressure, and then you pee, and then you wait again, and then you get 4-minute appointment, then you go labs and ultrasounds. They're looking for problems.
Mhm.
They're looking for something to fix, which isn't inherently wrong, except Studies show it is, because that's not really studies are showing that's not the safest way to treat low risk birth. We're treating pregnancy like it's an illness. We're treating birth like it's a problem that is just a ticking time bomb that needs fixing or will need fixing. So it's a reactive approach. It's like waiting for things. And what it sounds like is don't worry, don't worry. If you need to know, I'll tell you. It's like your provider is like taking control over the information. And it's not because they don't want you to have information. It's freaking impossible in a 4 to 12-minute appointment. At 4 is not that long because that's like, "Hey, how are you?" The niceties and, like, blood pressures and feeling your belly and finding the baby's heart rate. So, like, 11 minutes, a 15-minute appointment. Sometimes you're in there less than 15, sometimes it's longer. How
Yeah.
could they possibly educate you, right, on a fully, like, in control, making decisions, being autonomous, being an adult, understanding what's going on, knowing the next steps. They can't possibly tell you all of that information. So Sarah came up with this idea for today's video and I was like, "Oh, I love this." It is not all tied up, wrapped up in a bow yet. I think Sarah's going to wrap it up a little bit for us, but I want to know, I'm not seeing messages, so I'm wondering what is happening. I will pull up some of the other places that this is streaming live, so we can answer them. But I don't want to leave you hanging. I do want to know where this hits for you, though, and I want to know, like, are your are your appointments as expected? Does it feel like a kind of like a diminutive, just like follow the rules and follow along and just be good? Or is it more of like a relationship, like a give and take where you're heard and seen and you have individualized care specifically for you? I want to hear where this hits for you. And then Sarah, I want to know what is the modern way? Like what is parent-centered or patient-centered care?
Yeah, I just look at the Facebook page, and it doesn't look like we have any.
Oh,
Yeah.
thanks, Melissa. Y'all are
Oh,
just
there we are. Hi,
sleeping.
Melissa. All right. So, I really love what you said about proactive versus reactive because this is really the difference between when we're normalizing birth the way that it is and the way that it exists, and then also the difference between that and then whenever we're treating it like it is an illness. So like you said, looking for anything that could be going wrong, um, looking for the things that obviously the things that are going right, but also I think I kind of explain it a little bit differently because um, I consider patient-centered care to be more, or midwifery model of care to be more of like a reactive, because we don't anticipate problems to happen. We wait for things to come up and then we address them as they come up, as opposed to whenever we're in a medical model of care where we're really proactive, but maybe not in the best way, where we're looking for things to happen. We're anticipating something going wrong. We're anticipating something being a complication, and we're taking the steps to make sure that those things don't happen before we even know if they're going to happen. And so I always describe the medical model of care to be your proactive, but maybe not proactive in a positive light the way that we normally look at it all the
Yeah.
time. And then
Oh
reactive,
my god, you're totally right. Did I use that in the totally wrong term?
I think that you I think that in a certain ways that we can kind of look at it in a different light and see them both in proactive and reactive in certain situations, but yeah, you did say it opposite.
You were like, "Yes," and then your face was, like, melting, and I was like, "Shit."
No, I was just trying to like really wrap my mind around it because I do explain it a little bit differently, but the way you were saying it does make sense too. I think it's just about how perspective, really. Um,
Okay, well, thanks. We can both be right. That's just really nice of you. Medicine finds problems or creates problems
By anticipating them, right.
by anticipating them, treating pregnancy like it is a problem, and creating problems by using tech that is not diagnostic and treating it like it's diagnostic. What's that called?
Oh my gosh.
Like
That's
measuring
all
baby sizes and using ultrasound for so many things and EFM, external field monitoring for so many things. Like you're actually creating problems with the idea that you need to monitor so closely because there already is a problem just from pregnancy inherently, which is
right.
not turning out to be
So
super safe.
yeah, and I do wanna bring attention to the fact that some parents might prefer to have proactive care. If you have like an insane amount of, I don't wanna say insane, if you have a big amount of anxiety around pregnancy and you are gonna feel better about having really proactive care in a medical model of care, then that's on you. Like that's up to you. That's your choice. I think that there's a place for everybody to feel comfortable and go throughout their pregnancy and birth in the way that they prefer. So just because we're talking about the medical model of care being more proactive and potentially not being the best doesn't mean that we're saying that it isn't the best for you. So I did want to kind of backtrack a little bit and point that out too, because some people, I have clients who are like, um, yeah, but I want like an ultrasound every week if I can. And I'm like, okay, I mean, if that's what you want and your doctor is going to do that, then sure, that's up to you. Um, so when we're talking about the proactive versus reactive, medical versus patient centered, um, I just want to know that there isn't like, help me, Mandy, what am I trying to say here?
I
that
think that fear comes from the idea that we're supposed to be quiet and let the doctor do their job.
Yeah.
And our
Yes.
family members, our past generations, that's what they were told. That's how they treated doctors. That's how they, I mean, there's a dog issue.
Oh no.
Um, she's either on my lap or I'm looking to see what's happening. I I think that's created though. I mean, I think it's created because of the conversations that are going on around fear around birth, not trusting pregnancy, and trusting the diagnostic tests that we have as far as we can, and then not putting so much pressure and like diagnostic decisions on tests that are not diagnostic, meaning, you know, they just they can't tell you exactly what's going on. They can't tell you this measurement on this ultrasound exactly means this. There are so many limitations to the tests that we have in pregnancy that and I think there's still so many unknowns that creates a lot of fear. There's not a lot of control. That creates a lot of fear. It doesn't mean that it's necessarily right or wrong, but I think it has been created from our culture and understanding of birth.
Totally, totally. This is a good time to read the definition of patient-centered care because I think that getting into that and then talking about how we can recognize patient-centered care is kind of going to tie all of this together.
Sweet.
Um, Melissa says parent or patient-centered care. Mm, well, we say patient-centered care because really this can be applied even if you aren't a parent. This can be applied anytime that you're seeing a medical provider or you're being seen for something medical. Um, so
We just
yeah,
use it interchangeably in case the birthing person isn't the parent.
yeah. Okay, so the Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. So,
Pause for effect.
pause for effect. Right. Okay, so whenever I read this definition, I'm like, why is this not anytime we go to the doctor, right? Why is this not anytime we go see a provider, or go see anybody for anything? Like, our values, what does it say? Let's see. Our individual needs, values, and preferences are guiding all clinical decisions. We take these things, so we take our values, we take our needs, we take our preferences, we couple them with the provider's education, what they know about medicine, to make decisions about what we're experiencing or what is going on with us. What do you have to say about that, Mandy?
You know, I always have something to say.
I know.
Hey, Lindsay from Zimbabwe. I if we're not talking about pregnancy and we're not because like some of that can be hard to relate to. This sounds like my relationship with my kids' nurse practitioner. And it has taken 6 years because I switched providers 3 times when I had my child. In the office, I was like, "I don't like how you make me feel. I don't like how you shame about breastfeeding. I don't like that you don't know anything about breastfeeding, but you're teaching me." Like, no, no, no. I didn't say that to them. I respect them as people, but now after 6 years, seeing both of my children and seeing me, respecting me that I'm a nurse, respecting that, I have, like, values and I've had to stand up to her and be like, "Hey, thanks for mentioning that you believe, continued breastfeeding is going to rot my child's teeth out. Um, that has 0 impact on my decision to continue or not continue. So if we could just not talk about that anymore. I don't come to you for breastfeeding questions. So I don't need you to give me breastfeeding advice. How's that? And I tried to do it in like a passive way because we're in the South. And so I was like, okay, thanks. But like nothing's gonna change. So like if you could not ask, I'll let you know when we're done. That changed things there was a lot of time in between. So like we had some sick visits, we had some well visits, both kids. And then one day, like after COVID, it was like all we were supposed to go and we had all this time in between. And finally we went back and she was like, "How are you?" And I was like, "Fine." Oh, also she weaned because I was like not feeling great, like
Yeah.
summer of 2020, like who was
Yep.
feeling like their best, right? So I go and I'm like, "Oh, also she weaned like right after we saw you." And she was like, "Oh my gosh, that's awesome." And then she looked at me and was like, "I mean, how are you feeling about that?" I was like, she was taking into account what
Your
was
preference.
important to me, right? And
Right.
then when I go in, she takes into account my preference to not give antibiotics unless, we've tried other things. She either wrote a note, multiple notes, or she just knows me and like something clicked where she took a personal interest. But that's what that sounds like, right?
Right. And so that's how this kind of all ties in, because when we're talking about reactive and proactive care, we're talking about how different providers can have different ways of approaching it. They can anticipate things to
Yeah.
happen. They can anticipate things not to happen, and they have their own approach. They have their own experiences and their own education and their own. They had residency. They had all of these things that influence how they approach certain things, including pregnancy. Now, what they're taking into the appointment is all of this stuff. They don't know you from Sally Sue down the street. So you come in and this is all they have. This is all they have
Mhm.
to go off of. They don't know that you prefer to have a intervention free birth. They don't know that you prefer to have a repeat cesarean because you had a cesarean before. They don't know that you don't want IV fluids or whatever your preferences are. They don't know that you value holistic approach over medicinal approach. You have to come in and give that to your provider. And how to recognize that we're getting patient-centered care, as the title of this video says.
Mhm.
We want to make sure that the provider isn't just taking their bubble and not considering what we're bringing into the appointment too, right? Because when we come into appointment and they're only giving us one option instead of giving us all the options, they're only telling us what they think is the best option because of what they have right here, instead of taking into consideration that we prefer a holistic approach or we
Mhm.
prefer a medicinal approach. Um, if they don't take into consideration all of the things that we're bringing into the appointment, that is not patient-centered care.
Okay, but Sarah, um, does that mean that they have to teach me everything that I need to learn?
Absolutely not. It should be a collaboration. And so we're talking to our provider about our options. We're asking questions. They're answering our questions in a way that is actually answering our questions and not just deflecting.
Yeah.
Um, because sometimes what we can see is a provider will give us an option that they think is the best option because they have their blinders on and they have their experience, and then we say, okay, but is there anything else that we could do? And they say, I mean, we could, but, and that's
You already
hard.
know they don't recommend that first because they didn't say it.
Right.
But then
And
they
so,
say, "But don't do that."
right. So that's deflecting, and we want to make sure whenever we want patient-centered care, which should be always, we want to make sure that they're not deflecting our questions. They're taking our questions seriously. They're answering them appropriately, and adequately. And sometimes they may not know, something may not pop into their head. We've talked about this before. They may have their blinders on. They may be like, this is how I always treat this. It's always worked. Let's just do that. That's, it's a surefire way to do it. And you're like, but I don't want antibiotics. Um, but I did read about this. Could we maybe look into that? If your provider is doing patient-centered care, they will either say, I've seen the research on this. This is kind of what it says. Goes through everything with you, or actually, I've never heard of that before. Let me look into it for you.
Mhm, mhm.
And these
Now it's a
are
discussion.
now it's a discussion. So whenever you ask, do they have to educate you on everything? No, no.
That's
Um,
impossible.
yeah, it's not possible, especially in the short amount of time that usually
Yeah,
providers usually have with us. So it's important that we know our preferences. Doctor doesn't know our preferences. We know
right.
our preferences. We know what our values are. We know what we want out of our care. And so making sure that we are informed ourselves and we have a good idea of how we want that approach to be before we go into that office and talk to the doctor is going to be really important as well.
Awesome. Yeah, because I think providers can and do know their limits too. Like, a lot of providers that I see are like, "Gosh, like, there's so much I wanna give to this person, and I don't have enough time to do that," and they
Yeah.
missed the last appointment because, school's not in and whatever. They're giving referrals more than you can even keep up with.
Yeah.
There's just so much to know, and for your specific point, like, Jessica brings up high risk, um, some, like, high risk issues that they were kind of watching for. Her provider might be like, "I'm not saying that any of this is gonna happen, but if it does, it might happen at, like, 36 weeks, and then, oh my gosh, there's so much to learn. I won't be able to give you 45-minute appointments at 36 weeks. I already know my limits in my office. Consider these 3 things. 1's online, 2 are local." Like, it is their responsibility
Hmm.
to provide those references and resources because they can't be your everything.
Yeah.
That should totally that's okay. Totally
Right.
okay. Like, a confident, strong, passionate provider is gonna be like, "Yeah, I know a lot, but I cannot share that with you," right? If they're
Yeah.
not
Right.
teaching childbirth ed classes, like, how could you ever get all of that knowledge from them? And being confident going in and being able to make choices doesn't necessarily mean giving them complete control over your care and just being like, "I'll just tell you what you need to know when you need to know it." They're
Yeah.
gonna be like, "So many other people are teaching, you can have more time with them, like, go learn."
Yes.
Right?
I
Like,
Yeah, absolutely.
they can't give you all that information all the time. They can
Right.
give you their recommendations, that takes a few minutes. If you have questions beyond that, or if you have, like if you're like, "I'm not happy with this, I'll go figure it out." Like, "Oh my god, now what do I do?" That's
Yeah.
outside of your provider's office.
Yeah.
Yeah.
And so I think that actually like kind of takes us into the next point that we wanted to talk about, which is um, how to kind of advocate for patient-centered care if you're not getting it, and
Yeah.
also how to like how to recognize those like red flags. Like my provider is definitely not going to give me patient-centered care, the care that I need, because some providers are um, are very hesitant and very, like, I don't want to say hesitant, resistant. They're very resistant to allowing quote unquote people to have a big say in their care, because patient-centered care is just something that they've not practiced. It's something that they weren't taught. It's something that wasn't used when they were learning. And so that's something that you need to be able to recognize. And if you're not comfortable with that, you need to know when to switch. And also, it's important to be able to recognize that, because we've talked a lot about providers. Whenever it comes to pregnancy and birth, we want to make sure that our place of birth, our hospital, our birth center, our wherever we're giving birth is also patient-centered, if that's going to be, if that's what's important to you. So do you have anything to say about that?
No, we're just giving them a lot of to-dos. I like what you're saying. That's why I'm like, yeah. My keyboard doesn't work, but I want to know if you have heard of biases when your provider is talking to you. If you can, like, tell what they think is what you should do.
Right. This kind of is what we talked about like a couple minutes ago too, where you're like, but I kind of don't want antibiotics. Have you heard of this? And they're like, I have, but every time we use antibiotics, it works. So I would just say do that. Okay. This is
Right, but
not
you just
really a
ignored
patient.
what I said
Yeah.
and devalued my choice,
Right.
my opinion.
And this can become an issue of autonomy moving forward, because
Right.
when somebody believes that they know better for your body than you do, or they have more say over your body than you do, this can become an issue of autonomy. And so autonomy is just having the right of decisions and over your body in general. So when we hear words like allow, we don't allow people to get up after their water's broken.
Mhm.
We don't allow people to get in the shower after 6 centimeters.
Mhm.
Um, Policy says that you have to have IVs. You have to have IVs.
Mhm.
These are all issues of autonomy and not patient-centered, because if your preferences say different and they're violating your autonomy by pushing these policies, these hospital preferences, or even provider preferences, because this can, even if you're in the hospital, if there's a provider that's on call, that provider's preferences can be taken into account with the nursing staff as well. So those are all red flags too. We want to make sure that we're really paying attention to wording, because while we say that patient-centered care is great and like we want to figure out what our preferences are and stuff, we also want to be aware of that autonomy thing, where we know that we're not going to be violated with our autonomy.
Yeah, totally. It's a back and forth, and you're right about language. Uh, I'll put here after this live video, rules in labor, like hospital rules versus your rules, body rules. I did a video on that kind of like spoke to people. They were like, "Oh my god, you're speaking to my soul," because it sounds like there's so many rules, but really, like, if we go in with our own rules, I have rules about my own body. My kids have rules about their own bodies. That's that's correct. So when someone steps over those boundaries and is like, "No, these are the rules on your body now," all that needs to happen is a language change where you say or they say it's on both of us. Like, I say, "Oh, I can't get an IV because I throw up and because I'm sweaty and because I don't need one right now, and when I need one, I totally want one, but I don't need one right now, so I don't totally want one." That's some background. It's very hard to do in labor. That's why we kind of go through that in our classes of, how to communicate this with people ahead of time and how to communicate it with your partner that's gonna be with you, advocating for you. But then that other person who's like, "No, no, no, this is our policy, you need an IV." There's can be a totally different language around that in order to be like, "Okay, I totally hear you. This is why I wanna do it. You decide. As long as you have all the options, I'm gonna back up, I'm gonna chart it, and, like, job done. Keep doing your thing."
Yeah.
We can all be
Exactly.
comfortable with that.
Right. And it
Right.
all and that's one of the when we gather your thoughts, Sarah. So in prenatal care, this is it's a really good way to practice because like you said, in labor it's hard. It's
Yeah.
so hard to voice what our preferences are and really stand by that and advocate for ourselves because we're in labor land and that's
Right.
important for us to be in labor land and stay in labor land. We want you to be there in labor land. So practicing this with your prenatal care, talking to your provider about your preferences and having patient-centered care and using that kind of as like is this a red flag or are we good to go? Like, what's the deal here? Because if you start seeing those red flags, you're having a lot of resistance, you're not seeing the care that you want to see in prenatal care, you are now giving yourself the opportunity to take a step to advocate for yourself by maybe choosing a different provider or maybe choosing a different place of birth so that way you can get the care that you need so that you don't end up having a birth that you are unsatisfied with or you are traumatized by. There are
Right.
people who have traumatizing births because they're just treated very poorly during their birth and their autonomy is violated. And yeah, so not trying to go down like that dark road and this like
Right.
really like
Blamey.
polar.
We're not
Yeah,
blamey.
no, not blaming at all.
No.
But but we also need to take some responsibility for our care and know that at the end of the day like we have say over our bodies, we have say over our care. And so instead of being like afraid and being like, oh, doctor knows best or hospital knows best because they have the degree, or
Mhm.
also following our intuition and knowing what our preferences are and taking that and putting value and weight on that too for ourselves is super super important.
Oh, totally. And even we know access isn't the same for everyone. So even if
Right.
it's just one of those like upfront conversations where you're like, okay, I'm just going to get pumped up and go in and we're just going to have to like, this is my line, like stop or yes, or I feel this way when you say this. That can happen and change things without you having, or if
Yes.
you're unable to, for whatever reason, go switch. Like there's towns where there are not options like that. I'm not saying you need to drive 2 hours away just to get better care. It's not on you, it's on them. The problem is not parent or patient-centered care. That doesn't mean you have to fire everyone and, like, fly in labor. That's just not realistic. So, like, Sarah's
Right.
giving really great options for adjusting and making it feel more like, "Okay, let's listen to Mandy. Mandy's the one with the uterus. Mandy's the one freaking out. Mandy's the one who's never done this before, and, like, I need it all slowed down. So, like, how do we do that so that I feel okay moving forward every single time?" And
Right.
that can happen.
And I think that's really like the biggest benefit of learning like strong, efficient communication skills that are tailored to our comfort zone and what's effective whenever it's being heard and taken in, which is awesome because we teach that in our Fearless Birth Delivered class.
That's right, which it's the last day to sign up today for November's class.
Yes.
You knew we were gonna talk about it today.
Right. Of course. Why would
Today's a big day. And Sarah and I teach it together, and it's like this, but, like, way more fun and later at night. It's, like, in the
and in your
evening when
pajamas.
and in our pajamas, yeah. Everyone's wearing pajamas or yoga pants, and we're moving around, and we're getting crazy. But we're not anti-doctor or
No.
anti-provider. If that sounds like that today, no. We're anti-people staying in the early 1900s and practicing like birth isn't and can't be physiological and safe and powerful, and that the doctor's always in charge and has all the answers. No. The
Yeah.
biggest referrers to me and, like, pregnancy coaching one-on-one and my classes are providers. So, there are providers out there who are like, "Oh my gosh, you need all of the information. I just wanna hold you and" I, like, know a provider, "I just wanna hold you and tell you everything," and but they can't. So, they refer out and they're like, "Get this information and come back," and they know what they're gonna get. They know they're gonna get a birth plan. They know they're gonna see questions. They're gonna see papers full of questions. They're gonna see, like, pictures and, "Mandy said this, and I'm totally fine with that because then the provider's like, "Damn." Like, you know what you want. Like, that makes it great. That's where we're coming from. So if you join our class and you're giving birth with a doctor, it's great. We're not gonna
We're
say go get a different doctor.
I fully believe that you should birth where you're comfortable, and if in the hospital with an OB is where you're comfortable, that's where you should birth. Because
Yeah.
hormones and your where your mind is at is such a
Yeah.
huge factor in the birth process that if if I tell everybody to have a home birth,
No,
that is like no,
no,
no, that's not going to work for everybody,
no.
and that's okay. And that's okay. And I think that that's why having this conversation is so important, because you can have a birth where you're comfortable in a hospital with an OB and still be respected
Yeah.
and treated with patient-centered care.
Mic drop. All right, we have some questions. You can sign up. I can't put while Sarah's dropping her mic over there. I can't type because the dog ate my keyboard. So can you type fearlessbirthdelivered.com? She didn't, but like it won't work.
Oh my
So
goodness.
Sarah's going to type fearlessbirthdelivered.com, which is our site where you can sign up. Today's the last day. We got to get our coping kit in the mail. You're going to get this big package. You open it up. It's going to be love and joy delivered from Sarah. Sarah makes it in her house and sends it to you from Texas. And it's beautiful and wonderful. And we pick out all of these things that you're going to need in our class so that you can be hands-on and practice and be really good at what you learn. Because what is that noise? What is the point of learning things that you don't know how to use when you're like nervous, stressed out in labor? Your partner needs a lot of practice. Like, we're not used to doing this. So we practice. Lindsay, I'm guessing this is available to share. Yes, and you can share it now as well. You YouTube watcher, you. Thank you. Yeah, and I will link the hospital rules, what you can and can't do. That video will be linked at the end, or you can find that on my YouTube channel. And
Is that
thanks,
what you
Sarah.
want? Okay. I just want to make sure
Um,
it's what you want me to do.
Virginia asked, this is such an important video. Virginia, you are 7 weeks with baby number 2. You definitely need to hear this. Thank you so much. I'm so
Yay.
glad. Yeah, I'm glad you're here. You just kind of never know what you're going to get when you stumble across our videos.
We never know what we're going to get when we stumble across our
It's
video.
like a daytime talk show. I think I saved some of the files as like Sarah and Mandy talk show.
That's legit what it is, and I love it.
Jessica is a dear, dear friend. I was lucky enough to have an OB who was supportive but laid back. She wasn't looking for issues, even though I was at risk for developing high risk issues due to my BMI, but didn't hesitate to do EFM or ultrasounds if I had fears. Cool. So you had conversations. Like, yeah, you talked.
That's so good.
That's
I
so
love
good.
it when clients and students come back and they're like, you know, I voiced this to my provider and they talked to me about it and we decided.
Yeah.
Yes.
Yeah. Sarah and I don't care how many
Okay.
ultrasounds you have. No.
No.
As
I
long
mean,
as you know why you're having them, what the outcome is, their limitations, what that means for you, what your
and
choices
if
are about that.
yeah,
It's
yeah,
not just
if you
because
feel
your insurance will pay for it. But that's why a lot of them are done. Why not? Insurance pay, you don't have to pay anything. I'm like, "Oh my God, what if you do it and tell me my baby is 11 pounds?" That's meaningful, whether my insurance pays it or not. That's a consequence. Then I have to deal with it. Then I have to react, not deal with it, but like react.
yeah. And then
Um,
we have a whole new question and a whole new discussion that we have to have because now we have to figure out what we're going to do about that.
right. It opens it up. It's not like, "Oh, it's painless and it's free." It's not free.
Yeah.
It's free by money, but like my sleep is worth a lot to me, and I'm gonna lose sleep over that. She honestly couldn't tell me a lot, and that's kind of why I had a home birth. Just having people know that they can switch doctors, midwives. Yeah. Yeah, Melissa. Yeah, I think we talk about that a lot, just choice. And yeah,
Mhm.
we don't have we're not gonna be your provider, so
No.
but you can switch.
Yeah. Yeah. You can
Even
switch.
asking your provider if you can switch can give you a lot of information.
Yeah. Yeah,
They
I
should want
mean,
what's best. They should want what makes you feel comfortable.
yes. Um, oh my gosh, sorry. It made me cringe, and I visibly cringed. You're like, "Ask your doctor if you can switch." I'm like, "Ugh."
Oh,
I mean, do. Please do. But, like, yeah, you can definitely get a lot of information from that
so
question.
what are you gonna be for Halloween?
Me?
Uh-huh.
Um, I'm very shamefully admitting that I do not have a costume, and I spent a lot of money on my kids' costumes. So Benny's 4 for anybody who doesn't know, and he just discovered Ghostbusters, and he's like obsessed. Like he like he like walks around the house and he's like, "I ain't afraid of no ghost," and like Luther's behind him like beanie beanie beanie. I'm like, oh my gosh, Luther's my 1-year-old, right? So they
Bing.
make like this. I know it's the cutest, and it's definitely not timely like he's not on beat or on tune at all, but you can tell that's what he's doing. So I got Benny the ghost like a Ghostbusters jumpsuit with the proton pack, and
Yeah,
then
go.
I got Luther like a puffy slime monster
Ew.
costume. I know. So
Yeah,
Luther's
so
gonna
you're
be
out
the
of money.
ghost. Yeah, I can't. That's my amount of effort that can go in. But there's not trick or treating here. El Paso is where I'm at, and this is like one of the big hot spots for COVID right now. And
Yeah,
so we actually just went into another like lockdown.
I
And
heard about
so
that.
yeah, trick or treating's not happening. So we just bought my sitter and I bought like have a cauldron full of candy, and we were thinking about putting it all into a piñata and just having the kids hit it, and like we're making slime, and yeah, we have like a whole bunch of activities that we're
That's
gonna do.
awesome.
Yeah.
Now I
Yeah.
don't want to tell you what I'm doing because it's not that, but a piñata? My son always asks for a piñata. That's amazing. That's a really great way to be like, "I'm gonna have to bring up something in my house because my husband's like, "I mean, they could trick or treat a little," and I'm like, "No." But they know about the candy thing, so
Yeah.
I
We have
know I don't think he wants to trick or treat. I think he wants to, like, give a bucket of candy to other children.
Yeah. And I mean, it's not a horrible idea. We thought about doing like little bags of candy on like a
Mhm.
table outside so that if anybody wanted to come by and pick one up, but I don't want to bring any attention because they're actually finding people. And so I don't want like that to look like we're encouraging.
Mm-mm.
Yeah. And so we were just like, we're just going to take all this candy. We were going to do a Halloween hunt and like just throw the candy all over the yard and give the kids buckets and like let them pick it up. But then we were like, but that's not really like super fun. It's kind of like, eh. So I was like, maybe a pinata. Maybe we'll do a
Piñata
pinata.
is fun.
Yeah, pinata is fun.
Good idea. I told my kid I was gonna be a, Pokemon ball because one of them's gonna be Ash Ketchum, and the other
Right.
one's gonna be Pikachu.
Oh,
And I can't find that costume. It's somewhere in my house.
which one?
Pikachu.
Oh,
I'm dead. I'm so dead. I can't find it. Number 2, I have no intention of being a Pokeball. I'd have to make it, and, like, how?
just wear a white shirt, red leggings, and like a black belt.
I don't have that.
Okay, so maybe don't.
So, okay, maybe I need to go to alright, we gotta go. I gotta go to
Yeah.
Target. "Honey,
Right.
gotta go to Target." Sorry.
Sorry.
My Halloween costume costs $250. It's mostly candles and, like, rugs that we needed. Whatever, it's fall. "Oh, your Halloween costume is, like, Thanksgiving?" "Mhm. Yeah,
Exactly.
it's
Yes,
Thanksgiving. Yeah. I'm gonna
100%.
wear this wreath." All the wreaths. So bad. If I go in there, I'm getting a blanket.
I know. I mean, it is what it is.
It is what it is.
It's the sacrifice to the target gods. That's what I call it. Like
I
you
had to get
have
a coffee, and then there's dog aisle, we got a dog. Alright, we'll go because I gotta go spend some money.
Yeah.
Kidding. She's like, "Ugh, I'm uncomfortable about this conversation." All right. Don't forget to sign up by for Fearless Birth Delivered by tonight
Yes.
because Sarah's sending coping kits ASAP
Yes, yes,
to your
yes.
door, and we will see you on November 4th. Thanks for sharing.